So now we are going into grade 2 of evidence-based medicine. We have already finished with grade 4, that is case report and case series, where in case report you just report one person's one case, and in case series is similar kind of cases in multiple patients that are not more reliable. In grade 3 evidences, we already discussed about case control and cohort studies. These are more of an observational studies. And now we are going into more of a systemic studies, that are clinical trials. Now it's a prospective. So first of all, it's a prospective study, ethically designed studies where ethical consideration takes a huge role because you are doing it in human subjects. So any research you are doing in human subjects, ethical consideration is must, where the objective is to discover something new or verify that drug or compare the two drugs and their results for therapeutic benefit. So that is clinical trial, each and every word having its value. So prospective, ethically designed in human subjects, and to find out or to discover, verify or compare the two drugs for clinical benefits. Now, ethical consideration takes a huge role in clinical trial, and for that ethical considerations, time by time, the authorities, updates all the procedures of considering in clinical trials, all the ethical considerations that we should follow for clinical trials. So the major guidelines for that ethical consideration in clinical trial is good clinical practice. And in India, ICMR has brought out the guidelines about ethics for biomedical research on human participants. So these are the guidelines where in detail everything is been given, and according to that you need to go ahead with your trial. Very important part is informed consent. You need to take informed consent of a patient. You need to inform about the studies, the positives and the negative about the studies, and then you need to take the consent of a patient or a trial subjects. And now it is more of an audio visual. You need to take both the consent, written informed consent as well as audio visual consent you need to taken. There are 4 ethical principles you need to follow in clinical trials, and these are autonomy, beneficence, non-maleficence, and justice. Now let's talk about them briefly. What is autonomy? Autonomy means freedom, dignity, and confidentiality of the subject. So subject's freedom, dignity, and confidentiality should be maintained, and that subject has a right to choose whether he or she wants to participate in a trial or not. So it's her or his wish to participate in the studies. You cannot pressurize them to participate in the studies, and you need to maintain the confidentiality. So that is about autonomy. Second is beneficence, that your motive should be doing good to the subject and the society at large. Okay, so that is the beneficence you need to keep in mind while planning and executing the studies. Non-maleficence means not to do any harm or put the participants at undue risk or disadvantages. So for your benefit, you cannot just put the participant at undue risk. So that is again a major critical consideration in ethical guidelines, non-maleficence. And eventually a justice. You should do the studies fairly, not be biased or partial about any of the drugs. Okay, so that should be consideration, all these criteria for analyzing and data communications. So these are 4 basic aspects of ethical considerations of clinical trials: autonomy, beneficence, non-maleficence, and justice. Now important terminology here. Now we'll see every terminology in brief. What is controlled trial? Where it is, as the name suggests, controlled means we are adding another group that is called as control group in clinical trial. So control group or comparator group. Comparator to which? Comparator to our test group. So for an example, you are testing drug A So we will add another group, that is drug B, or comparator or placebo. Now we already know what placebo is. So we are adding placebo or drug B to compare, and that is called as control. So you are comparing control with test, and both the results are compared, and eventually you are going into the conclusion. So that is called as controlled trial, where you are adding a comparator group or the control group, and you are comparing the result of both the groups and eventually coming on to the conclusions. Now, if you are adding this control group, a drug should look more of a similar to the drug of test. So both the group should be similar characteristics, and if you are using placebo, ethical permissions should be taken, or if you are using another drug, you need to take permissions from ethics committee. So before doing any trials or clinical studies, ethical permissions is important. Their permissions you can take from institutional ethics committee or individual ethics committee or ICMR registry. Now we'll go to study designs. Mainly there are many types of study designs are there, but we'll discuss two of the important types of study designs, that is parallel study design and crossover study designs. Now what is parallel study design? As the name suggests, here two groups are there. One group is test group and another is our control group, right? So in parallel study design, you include the subjects, you do the randomization, we'll see in details, and then group 1 will receive test and group 2 receives reference or the control, and now you evaluate or compare the results of both and you conclude the study. So here one group receives the test drug, one group receives the control drug, and eventually you compare them and conclude the results. So that is called parallel study design, because you are going parallelly in each group. Right. Now what is crossover study designs? Now what happens here? Here you are including study participants or subjects. You do randomizations and make two groups. Here group 1 receives drug A, group 2 receives drug B. But after some time, you give washout period. Means after some time, for an example 15 days or 5 days, now the drug is been interchanged. Now same group A receives drug B and group B receives drug A. So what happens here? Here the group is same, but the same group receives two individual treatment, drug A and B. Here also group is the same. It receives two individual treatment. Firstly, it receives the drug B and then drug A. So each individual gets two drug, right? But after some washout period. Now what is this washout period? Washout period is a time which has been decided depending upon the T half of drug. We have already seen that drug remains in the body for 5 half-life. So we need to choose that kind of washout period, that drugs has been completely washed out from the body, and now you are introducing new drug so that the results cannot be interfere or because of the cumulative effect of initial drug. So that is called as washout period, or a time from which you can now shift from drug A to drug B in same subject. So here each number of patients in each group receives the two treatment over the period of time. So each individual acts as its own control, because he has taken drug A as well, he has taken drug B as well. So now you can see the responses. So this kind of study is called crossover study, where you are crossing over from one drug to another drug. So both the groups received both the drugs, that is crossover study design, while only one group receives one drug and another group receives another drug, that is called as parallel study design. Hope you understand this. Now one more terminology important in clinical trial is bias. As the name suggests, bias means you are being partial to one side. So that is the bias. and there are many ways this bias can happen in clinical trials. So they are kind of a systemic errors, and they can eventually affect the outcome or the conclusion of results. So that bias can be from many a side. That bias can arise from participant side. That bias can arise from investigators who are involved in the studies, who are keeping watch on the studies. So they can arise from both the parties. So it is susceptibility to both the parties. So to reduce that bias, two strategies are important. One, that is randomization, and second, that is blinding. So bias is a partiality that can be arise, or errors that can arise from both participant as well as investigator side. And to consider that or to decrease that, we need to take two actions: randomizations and blinding. So what is randomization? As the name suggests, you are randomly allocating patients or the subjects to different groups. So that is randomization. Simple. So subjects are allocated in either group. For example, VOC, we had test group and we had reference group, and you have, for an example, 40 number of subjects. So you are randomly allocating 20 into the test group and 20 into the reference group. That is called as randomization. So you are randomly allocating the two into patients into the two groups. Now these randomizations having its method. There are different methods by which you can do these randomizations. Mostly they use random number table or computer programmed. Computer itself, makes juggle of those 40 numbers, and itself randomly they choose, for an example, number 1, 5, 8, 7, 15, 18 into the group A, and 2, 7, 6, 4 into the group B. So this is how a random allocation that is been created with computer generated program, or there is also random number tables also available by which you can do these randomizations. So that two patients can be assigned to test and reference. Sometimes we do stratified randomizations. Now what is stratified randomizations? For an example, if you have taken total of 40 subjects. Now in those 40 subjects, like for an example, you have males and females. You now have different cofactors, like few are males, few are females, few are having high activity, who are highly active, who are having low activity, who are taking high carbohydrate diet, who are taking low carbohydrate diet. So there are many cofactors associated. Some are of a particular age group, like for an example, some are from age group of 20 to 40, some are of age group of 40 to 60. So all these cofactors are divided equally in this both the groups. That is called as stratified randomizations, where you consider all the cofactors in those 40 subjects, and you even divide those cofactors so that the strength of a study increases, right? So that is called as stratified randomization. So all the variables are equally divided into the two different groups. So there are two ways you can reduce the errors in clinical studies or bias in clinical studies. One is randomizations. You can do random allocations of clinical subjects. And second thing you can do is blinding, or it is also called as masking. What is blinding? Blinding means concealment of treatment. Someone don't know what you are giving. That is blinding. So blinding from subject, that is single blind, and if blinding from subject as well as investigator, it is double blind. So what is it basically? In clinical studies, usually a drug is being given to the patient by investigator. Now sometimes in open studies where there is no blinding, where there is, for an example, group A and group B, group A receives drug A and group B receives drug B. Now in single blind studies where patients don't know which drug they are taking, so in that, in both the group, the drugs are of similar look-alike. Only investigators and a third party knows what they are giving to whom, but patients in both the groups don't know which drug they are taking, right? So that is called as single blinding, where patient don't know which drug they are taking. And what is double blinding means, even investigator don't know which drug they are giving to whom. So only third party is been there who's keeping watch or observing them. They knows which drug is being given to whom. What is the purpose of doing this kind of stuff is we can decrease the bias from observational from individuals as well as investigators. So if you are using two medications in this kind of blind studies, both the medication should be similar lookalike, right? Otherwise the patient would get to know that okay, these are red medicines and the green one is a placebo. So patient will get to know about things and there are chances of different observations. So if you are using two drugs and in one if you are using a dummy medications, that dummy medication should similar lookalike, similar in number, weight and tests. And in double blind, a particular key code of allocation treatment is given, on which basis a third party or data management party can get to know about the drugs which is been distributed. And eventually that code is broken at the completion of a study. So this is how a blinding is being done with single blind and double blind. And if there is no blinding, these are called as open trial. The credibility of those kind of trials are not much. So to increase the credibility of results, we need to do random allocations as well as blinding. So randomized and double blind control trials are the most credible method of obtaining the evidence. Now, what is inclusion and exclusion criteria in clinical studies? There are few criteria we need to predefine, and on what basis we need to include the patients. For an example, if you are doing any studies in diabetic patients, first you need to make inclusion criteria. Like which patients you want to include, male or female, which age group, 18 to 20, 20 to 40, 40 to 60, or all. Which kind of diabetes, the range you need to predefine, the range of 126 to 180 fbs or more than 180, you need to decide. So there are different ways you need to specify and on what basis you need to. Similarly, you need to decide exclusion criteria, that which patients you will exclude. Like for an example, we will exclude nursing mothers, we will exclude pregnant females, we will exclude those patients who are already on treatment, right, who needs insulin. These are some of the examples. So these are kind of exclusion criteria you need to pre-decide, and inclusion criteria you need to pre-decide, and on that basis you need to recruit the trial subjects so that the trial results applicable to only populations that are specified by those criteria.